Hi, I'm Paulina, CEO of Spakinect. Today, I'm here with Amber Bechthold of Aesthetic Compliance Experts, and we are going to be talking about all things compliance. Yes, I know, very exciting compliance, but it's what you need to know if you practice aesthetic medicine, if you are looking to open an aesthetic practice, or maybe you're trying to get in as a medical director or a nurse injector. So we're here today to talk about all of the fun things to keep your practice safe, your license safe, and of course, your patients safe. So welcome, Amber.
Thank you. Thank you for having me. Glad to be here.
Thank you. So tell me, Amber, a little bit for our viewers, how you got into aesthetics and what kind of drove you to create aesthetic compliance experts.
Yes, absolutely. So I've been in the medical field since that's the only field I've ever worked in. And so not to show my age, but it's been over 20 years. And I started working at a hospital back at home, and I'm from West Texas. And so um, just working with the nurse there at the hospital, she was the hospital nurse, if you will. We started working on compliance, and of course, I didn't know anything at the time, but just building out the hospital compliance. Of course, this is way more than what I do now, big scale of compliance, but just gain my knowledge and kind of understanding of compliance back, then. And then fast forward, 8 years ago when I moved here, I started working for a plastic surgeon in the area and just kind of learning about aesthetics and things like that. Moved on to my next position, overseeing a standalone med spa, and kind of worked on helping them put their compliance together and just really learning what that meant for, the state of Texas, like what all does it entail, So we built out compliance there. I went back to school to be an esthetician over COVID and was a provider for a little bit, and then decided, hey, I could actually make a business of this, because as I was working in the industry, I just seen so many things that, people weren't doing safely, appropriately, those types of things. And so I thought, well, let me consult. And so I started consulting about a year in. I quickly pivoted to compliance because everybody was asking for it or what it was. Some people didn't have any knowledge of it, but I learned that it was a job within itself. And so I completely stopped consulting, and now I just do compliance
Wow.
for, we're in 23 states now. So, but Texas is where we started.
Wow, that's incredible. It sounds like you have a breadth of knowledge, not only in the medical field, but also in aesthetics. So what exactly do you offer for your clients?
So we offer compliance at from a standpoint of OSHA, HIPAA, your governing entities for your medical practices. So in Texas, you've got your Texas Medical Board. You also have TDLR. Texas Health and Human Services oversees the radiation portion of, laser. So overseeing the portion of lasers. So those types of things, we offer a package, and it's completely built out. So that's our specialty. That's kind of our niche, is we actually build out your compliance packages for you. So they're physical binders, and we put your logo on them, and we make them your own. And they have, sorry, got a dog right over.
That's
But we've
okay.
got, again, it's OSHA, HIPAA. You have your standard office procedures, and then you have what we've created is just a compilation of important things that you would have to hand over to an inspector should they come into your practice. So you want to navigate that quickly and easily to have them out of your hair so that, you can go back to seeing patients. So
Yes. It sounds like you give your clients peace of mind, because I would want that if I was a provider having my own med spa or working in a med spa, just knowing that all of the compliance documents have been done, they're executed, they're in this nice pretty binder, and I'm just a sucker for things in binders too. But seeing that and having that, and knowing that you have something to lean on if there ever were
yes.
an investigation, or like you said, an inspector coming in, that's huge. So I love that you're offering that to practices, and there's such a need because regulations are changing all the time and it's very confusing. So having someone that you can rely on and call
Yes.
and lean on when you have questions is priceless. So let's kind of start talking about maybe something that's exciting or maybe a little bit, maybe, what's the word for it? The situations where you might not want to find yourself in. Could you tell us about what are some of the mistakes commonly made that you see from practices in aesthetics when it comes to compliance?
Um, just not having compliance at all. So we have, many calls where we'll get on a call with the client and they'll be like, oh, what is compliance? Like, I don't think I have anything. And then, you have clients that have bits and pieces. They've tried to start on doing it on their own. So I think just not having it in place at all. And just, knowing that they have to, because they hear the buzz in the industry that compliance has to be, something that you have. But I would say that's the number one thing.
Mhm. So just not having any policies in place, any SOPs, not meeting the standards for the various regulations in the state.
Absolutely. Yes.
Yeah. And so I know you said with Texas, we have a few different regulating bodies that people need to be aware of, but what are the key sort of areas of compliance? Can you just sort of bullet point those? I know you mentioned OSHA,
Mhm.
HIPAA, but what are those what are those main compliance areas that people need to be paying attention to?
So specifically in Texas, like you said, you have your OSHA, HIPAA, you have your Texas Medical Board, you're going to have your Texas Health and Human Services. If you do any types of lasers, laser hair removal, IPLs, any of that, you're going to have that entity overseeing you as well.
So would you consider aesthetic compliance experts to be like a one-stop shop? Like if somebody is just overwhelmed, I don't know how to make sure I'm compliant with all of these different places, they come to you,
Mhm.
you'll give them all that information.
I will. And we even go a step further. So we not only give you binders, but we also offer a service where we can audit your clinic. So we do virtual audits and then we do in-person audits. If you're in the area or not too far, we've done many of those. But that's just us going in, checking your clinic, making sure that your proper signage is hung,
Mhm.
you're following HIPAA policies, that type of thing. You have to have your providers have to have certain things in their clinic to identify themselves. And again, back to the signage part of it, but just going through the clinic to make sure your injectables are locked up properly and that
Mm.
type of thing.
Yeah, those are things I think people don't even think about too, is right, how are your injectables being stored? I love
Mhm.
the in-person audit. It's kind of like a secret shopper almost, right? You're coming in and just taking a look at everything. I think that's brilliant. I love that.
Yes.
Can you walk us through any recent case or investigation that you know of where a client of yours was found to be not in compliance? Like what actually would happen if one of these regulating bodies finds that you're not in compliance? What would happen?
So there's a few things, there's, the very minimal things that could happen is, just a fine, a closure until things are, updated and put into to place. But there's also that, the more extreme cases where you could lose your license, they can close your practice. It just really depends on, the inspection and what comes of that. So as far as anything that I've seen, I worked on a case with a client here in the South Lake, Texas area, and she was subpoenaed for practicing medicine without a medical license. And so we went through a rigorous 9 months of her having to submit document after document. And it was just really stressful. It was a long, drawn out, almost a year, process, but we went through just affidavit after affidavit, supplying those things to the medical board. And it really was, it came down to a disgruntled, a disgruntled past medical director, said she didn't have a new medical director because they parted ways. And so, but yeah, it was just, and then when we thought it was all over, she called me and said, "Hey, I just had a corporal come in with a big gun, and I they said they didn't know why they were here, and they were here because of the subpoena, and they just said, hey, we're just we were told to appear. This is this is what we're doing, and then they left. So I think there's some scary things that can happen, but there's still some, you know, there's still some loopholes in the things that they do. So yeah, I think that would be the most recent one. I can speak on another one where a trainer was he trained somebody and he called me and said, "Hey, I just need to make sure my policies and procedures are up to date because I did receive a subpoena from the medical board." And basically, he was being accused of performing a surgical procedure on somebody that he had trained. And he was like, that's absolutely not true. And so you just have to go through the process when those things happen. And I think that, even if nothing comes of it, it is still very stressful because you don't know the outcome. And so it's time, it's money, it's keeping you awake at night. And so just making sure that, you dot your I's and cross your T's when it comes to compliance. And, you can't always, I guess, foresee the things that are going to come, but you can do your best to, get your foundation down.
Yes, absolutely. Thank you for sharing those because
Yeah.
I think that's really relevant for people when they're trying to understand, how would this actually happen if I were to be investigated? And like you said, sometimes these claims or reports can come from disgruntled ex-employees or even
Mhm.
patients or maybe a competitor. And the board does have a duty to investigate those.
Mhm.
And so the more you have already documented and readily available, right, in a
Mhm.
binder or what have you, then it just makes that process so much easier. So you don't have to worry so much, because it's not necessarily a bad thing. I always like to tell our clients as well is that, the more exposure you have, the more patients you see, the bigger you grow.
Right.
It's likely that at some point you will have an investigation, and that doesn't
Absolutely.
have to be scary, right? So you can have everything in place so that the investigators end up going on their merry way.
Yes. Yes. And I also like to kind of make it a point to tell my clients when I speak to them that, you know, by having these things and being able to feel the confidence and hand them over to the inspector, because I've had our clients call us after that's the case, and they're like, "Oh, it's such a sigh of relief to be like, here you go." And they look
Mhm.
through them, I pass my inspection, and they're on their way. And so that's we're really trying to be proactive rather than reactive
Yeah,
when these inspections happen. So we've heard stories that inspectors can be in your office from 4 to 6 hours, and that can be very stressful for you when you're trying to see patients and you don't want them to think, oh my gosh, what is going on? That the
right.
inspector's here, those types of things, because they don't know. So just staying ahead of one step ahead of them is always what I recommend.
Absolutely. So, when you're working with some of these
Yeah.
clients, I'm assuming that you've encountered some clients that are doing good faith exams or maybe not doing good faith exams. Can you
Mhm.
tell me a little bit about what are some of the considerations that people should be aware of, especially in the state of Texas, when it comes to good faith exams?
So I think that the majority of people know, but we have seen in these smaller cities here that are still, not as quiet, caught up as, the Dallas Fort Worth area, which is where I am. But they're a little behind on times. They're not quite understanding, the things that need to be in place. So we worked with a small clinic out in West Texas, and they had their RN doing the GFEs, and we were like, okay, like your nurse practitioner, your physician has to do those clearances, and they have to be done once a year. And so they were either just not doing them or having the RN do them. We even worked with a injectable um, academy that was having their admin staff do them. And we were
Mhm.
like, okay, this can't happen. So just making sure you understand what all in the good faith exam entails. So in Texas, you have to have a good faith exam yearly. You have to, it obviously, again, it has to be done by the nurse practitioner or a physician, a mid-level or higher. So making sure that those things are done. But one of the things that I've come across that I would have never thought of if I, wouldn't be in the world of compliance, but is people doing or, providers doing good faith exams, but not updating when somebody has, maybe they've been diagnosed with a new medical, a medical what
Condition.
is the word? Yes. So if they've been diagnosed with something new, they're just not updating those things, making sure they're doing the rigorous, questions. So basically, when you go into a doctor's office, has anything changed? No. So really just going over, I always recommend these are the medications that we have listed for you. Are you still taking those? Are these still the medical issues that you have or don't have or whatever? Because if you're not thoroughly doing it and you're asking a yes and no question, they're going to be like, yes, because they don't remember what they put on that exam a year ago, 6 months ago. So just really doing your due diligence as a provider and really thinking outside of the box and asking those questions because you can find yourself in hot water if you're giving somebody something that's a contraindication to a medication they're taking. So just being very thorough.
That's such a good piece of advice for providers, clinicians, especially the ones who are doing good faith exams, because like
Yes.
you said, that's what Spakinect does for a living, and our providers do this day in and day out. And we find the same is that you have to get creative about how you ask those questions
Mhm.
because patients, of course, you want to skip through it. I do it too. I'm guilty. We're all guilty of it, right? You're like,
Yes.
oh, nothing's changed, and
Nothing's changed.
no,
Yes.
no, check all the boxes, but you want to get through it. So I love that you brought up asking a question in a different way and bringing
Mhm.
up, these are the medications that we have for you. Are you still taking these? That's such a good way to get more truth out of the patient and get them to just open up a little bit more. So that's
Yes.
a great piece of advice.
Yes. Yes. Absolutely.
So when it comes to patients looking for a safe place. We've been talking about compliance. Why is compliance important?
Mhm.
There's a lot of stories that are coming out right now, as you know, about some providers and locations that are not only not operating in a compliant manner, but also putting their patients at risk. For
Mhm.
example, using injectables from overseas, perhaps even doing procedures on patients when they don't hold any medical license or any of the required training. And
Right.
so I'm curious, in your eyes, what are some things that a patient could look for when they go to a new med spa to make sure that they're visiting a place that is safe and compliant?
So I definitely recommend everybody doing their homework, obviously, before you even sit down in that provider's chair. But as a patient, I think, we're in those times where you can advocate for yourself, even in the aesthetic setting. So just really asking those questions like, there's nothing wrong with you saying, hey, can you draw those up in front of me? Can I see the FDA approved, logo on the boxes? There's nothing wrong with that. And I think injectors that are ethical will not have a problem with you asking those questions. I think, in fact, that they would appreciate it. So just, asking those things, really being mindful of the certifications that they have on the wall, just looking, asking questions, get to know your injector. I think, again, that they will appreciate that. So I see so many injectors now posting, the educational side of things. And so I really think that we're all, eventually going to get there, but being, just questioning, just asking those questions and not being afraid to.
Hmm. Yeah, what I hear from that is really
Mhm.
encouraging patients to be their own advocate.
Yes,
Hmm.
absolutely.
Hmm.
Advocate for yourself. It's
Yeah,
important.
absolutely. I think that goes for all facets of medicine, not just
Yes,
aesthetics as well, right? Yeah.
yes.
So how often should a practice be updating and maintaining those compliance docs? So let's say we have a med spa, they've come to you, you've given them all of the regulations, all their nice, beautiful binders with all of their
Mhm.
policies. So then it goes on a shelf, and then what happens?
Yes. So we do a little bit of education on once our clinics buy from us, we do a manual review call. So we go over the binders, we go through them so that we can educate them on how to use them, making sure that they just didn't you know, uh, invest their money on something, like you said, that's just going to sit and collect dust. Like you need to know how to, um, go through the binders. You need to know what your responsibilities are as a provider. And most of the time, you kind of have to direct your medical director because, um, you know, they have their primary job that they're doing. So just really helping them navigate that as well and what compliance looks like. So just and I lost my train of thought. What was your question?
That's
Sorry.
okay. No, yes, how often should people
Yes.
be updating those policies, and is that part of your package?
Yes. And so we recommend best practices every year. There are states like Texas that require you to do it yearly. There are other states that you only have to do it every 3 years. So um, again, it's best practice to do it yearly. In Texas, you do have to sit down with your medical director and do a quality assurance, you know, sign off every year. And just to kind of dive into that a little more, you want to sit down with your medical director more often than that,
Mm,
but at least yearly, because I think what we also see is a lot of clinics will not think because, there's a lot of moving parts in a clinic. We all know that, but they will add a procedure, they will add a device and not think, "Oh,
mm,
this affects my medical director, this affects my standing delegation orders, this affects, all the things, my compliance binders." So they don't update it across the board and all the things in their clinic where it needs to be. And so sitting down with your medical director, you have your mid-month, your medical director needs to be meeting with your mid-levels every month. So that kind of helps navigate that as long as you're doing it. We see a lot of clinics that don't, but just catching those things and those things that the state of Texas has set, to be the standard. But yes, that's what I would say.
I have actually seen this recently come up a couple of times where a provider, let's say a nurse injector, added new treatments to their suite and didn't clear that with their medical director, and then actually found out that the medical director wasn't trained in those specific
Right.
modalities or those treatments. And so right there, you don't have a delegation order to perform those treatments. So there's a lot of, potential compliance and, potentially dangerous outcomes that could happen out of that. So
Absolutely. Yeah.
what are some of the things that you're seeing people do to, kind of combat that? How can we make sure that we're operating where our medical directors know how to do all of these procedures that we're doing?
I think it's just going back to the educational side of things, and that's kind of where we come in as the experts in the industry. We do offer some things that can help keep you compliant for 6 months to a year. And right now we're only doing that in Texas and Georgia, but eventually we'll expand into the other states that we're in. But just really training yourself to be mindful. Hey, I just added a new skin pin.
Mm.
I need to update my compliance. And so those are conversations that we have in our manual, review calls that, you know, hey, just really be mindful that anytime you add anything, you need to be updating your compliance. If that's something you need us to help you navigate, just give us a call and we can, help you and make sure that you're doing it across the board again.
So if, let's say this, like use a hypothetical situation where a nurse injector wants to add in PRP or maybe some sexual wellness
Mhm,
injectable, something like that.
mhm.
And their medical director is not trained on those things. Can that nurse injector then train their medical director on those procedures?
So that's a good question. So in Texas specifically, and I keep going back to Texas, of course, because that's where I am, but every state is different. So in Texas, there is no regulation around who can train who. So as of right now, if there's a nurse practitioner or RN that wants to train their medical director on how to do that, they absolutely can. There are things that they won't be able to train them on. So like they would need to go get their certification for basic laser hair removal that is required in the state of Texas. But as far as like injectable trainings and things like that, absolutely you can train them.
Wow, that's probably something a lot of people don't know.
Yeah.
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 Okay.
It's still one of those areas I don't think that they've thought through quite thoroughly. And so I'm getting a lot of those questions now as more providers are starting to open up, their aesthetic academies, making that a portion of their clinic. So I think we'll see more and more of that and maybe, hopefully some regulations around that.
So that's a good segue into what do you see changing or coming through the pipeline in the next 5 to 10 years with compliance in aesthetics?
I think that, just the updates, in Texas and Illinois are good examples. I think that's the state's way of saying, hey, we're starting to clarify things. This is a good way for you to start getting your ducks in a row, and making sure that everything is compliant in your office.
Mm-hmm. Mm-hmm.
Yeah.
More regulations
Yeah.
likely, coming out, you think?
Yeah, I definitely do. Again, I think just there was something I was gonna it was on the tip of my tongue and
There's
I forgot.
more.
Sorry.
I think I'll take that from you. I think that there's more specificity that's going to come out, kind of how
Absolutely.
we've seen with the Texas administrative codes being updated on
Mhm.
January 9th. And, more and more as aesthetics starts to grow, it's not slowing down. I also hope and I think that more boards are going to be coming out with regulations, and we hope that they are in line with best practices and,
Mhm.
not too restrictive for providers in the industry. But ultimately, I think when agencies come out with more clarity around their regulations, it really just helps practices and injectors know that they are operating within the guidelines of the law.
It gives them that confidence that I think sometimes they might lack because they're like, well, the law's not really clear. When you
Mhm.
read it, you could interpret it this way or this way, just depending on who's reading it. And so I agree with that.
Right, exactly. Yes, I think it's very comforting to have the knowledge and the understanding that you are practicing. You're not in a gray area, and there is still a lot of aesthetics that's in a gray area that I think makes people a little bit nervous.
Yes, yes, definitely. And back to the point that you made, with the changes that Texas made on January 9th, there's a lot of it that was already in place. They were just kind of spread out in different codes and they kind of compiled them and put them in one place. But all those things, identifying yourself as a provider, that's something that is, it's something you should be doing as a medical provider anyways. I think sometimes people forget that aesthetics is still medical. So, in every aspect. So identifying yourself as a provider, your medical director's licenses being hung in the clinic. These were already things that were again scattered throughout the codes, but now that they've kind of brought them together into light, people are like, oh, they made changes. And when in actuality, it was just more they were clarifying things so
Mhm.
that they were black and white and not they didn't fall into that gray area that we're talking about.
Mhm. It's so interesting, the name tag or the displaying your name and credentials too, where in other facets of medicine, I mean, I'm an RN myself, and when I work in the hospital, as many people know, you see who is an RN, who's an MD, because it's very clearly displayed on their badge in really big letters, usually with different colors. And I think
Yes.
we, in aesthetics, we are now getting better at that, but still, I've visited plenty of med spas, and a lot of them are not doing that. They are missing that
Yes.
step right there. And it can be a little bit jarring to a patient because they don't know, are you the esthetician? Are you the
Uh-huh.
RN? Are you a doctor? And maybe if you're just wearing scrubs, sometimes patients assume that you're a doctor or you're a nurse, right? So
Yes.
that's such an important thing to also give your patients that peace of mind.
Peace of mind. Yeah,
Mhm.
absolutely. I think sometimes as providers, and I can speak because I was, a provider as esthetician, but just taking a step back as a provider and just looking, from the outside in on things like that, just going back to the basics, like, how was I trained as a nurse? How did I do things previously when I was in the medical setting, and just kind of bringing that over into the aesthetic space. It seems very, again, basic, very elementary, but it's those fundamental pieces that we need to
Yeah.
pull into the aesthetics.
Absolutely. So if a practice is not sure about their compliance status, what's the first step that you recommend that they take?
I definitely recommend, we're here to do compliance for you, but I recommend doing a discovery call, just, jumping on a call. We ask all the questions to kind of see where you are in, as far as compliance goes, what you have in place, what you don't have in place, and we can help you kind of navigate those things. And we do audits on clients that already have, hey, I already paid my lawyer to do compliance. Will you just make sure it's up to date and make sure nothing's missing, that type of thing. And so, most of the time those go really well. We just, have to kind of fill in some pieces. But sometimes it's, hey, these haven't been updated since, 2020. So, we completely start over. So that's what makes the most sense. But just getting with somebody that knows aesthetics, knows everything that needs to be in place as far as compliance goes, and getting that set for your clinic. It's going to help you sleep better at night. We hear that so many times, like, oh my gosh, I can sleep at night now. My compliance is in place. So
Yes, absolutely. I love that more people are out here like you doing compliance work because
thank you.
we think compliance is sexy. Not everybody thinks that, but I'm so glad when I meet fellow compliance people that, care, because I do feel like the peace of mind that it gives providers, especially new entrepreneurs in this space, you don't want to have your license and your practice, everything you've worked so hard, be at risk just because of a preventable compliance error
Yes.
oversight, right? So I think it's really, really important work that you're doing, and I'm really happy to be sharing your message and your advice with all of our clients.
Thank you. Thank you. I appreciate that.
So my last question, just to wrap up, this is more of a fun question that I like to ask everybody, but if you had $5,000 to spend at a med spa,
Ooh.
what? Yes. I used to say if you had $1,000, and then people were like, that's not enough. What do
It's
you,
not enough.
I
Yeah.
can't even get
I thought
out,
there's even buy a
I
package.
can't even get anything. So I said, you're right. So if you had $5,000 to spend at a med spa, what's your go-to treatment?
I would definitely say some IPLs now that I'm, getting up there in age, but injectables as well. So, some Sculptra to help build some collagen, elastin, that type of thing. Got to have those toxins. So,
Yes.
my go-to toxin is just Port. It just works well for me.
Yes.
But definitely, and getting some good skincare. They all go
Mhm.
hand in hand.
They all go hand in hand. Yeah, skincare can never be too underrated. So, well, thank
Absolutely.
you, Amber. Thank you for sharing everything today with our viewers. And where can people find you?
So you can find me on Instagram. My handle is aesthetic_medspa_compliance, or you can find me at aestheticcomplianceexperts.com. You can also find me on Facebook, and you can give us a call, 817-678-6080. We're happy to help.
Fantastic. Everyone, reach out to Amber with all of your compliance questions. She is here to help. And thank you for being here with us today.
Yes, thank you for having me.